Hello, this is Uncle Garrett again. I hope you're having a great day. Today I'm going to start a series on the subject of gender transitioning, starting with this first installment, The Truth About Puberty Blockers. Let's start out with the question of what are puberty blockers? This will be a more technical presentation, so I'm going to be showing slides along the way. So puberty blockers are GnRHAs. I'll pronounce them GnRHAs for short in this presentation. They're a class of drugs that interfere with the hormonal signaling between the hypothalamus and the pituitary gland. The pituitary gland is that which produces either testosterone for males or estrogen for females. Now, the signaling between these two is something that originates from the hypothalamus and signals the pituitary gland to generate more or less of those sex hormones. Now, the thing that interferes with it are these GnRHAs. The most common one is Lupron, but there are many others. And the way it interferes with the signaling is it actually overwhelms the sensors on the pituitary gland and actually gets those sensors to deactivate or in general, the pituitary gland becomes less sensitive to the signals from the hypothalamus, and so it stops producing those hormones. So, a little bit about the history of Lupron, again, the most common GnRHA type drug. It was initially approved in 1989 for the purpose of for treating prostate cancer. Now, the reason it helped with prostate cancer is once again, it eliminated the testosterone in the males, which actually was one of the key ingredients in helping prostate cancer grow. So, cutting off that the testosterone helped with the prostate cancer. It was also used in various forms as an alternative for surgery in castrating sex offenders. And so instead of actually cutting off their parts, they would chemically castrate them by giving them a large dose over time of Lupron. So not long after, just 4 years later, Lupron was approved as a drug for treating precocious puberty. This is where puberty starts in children for girls before the age of 8 and for boys before the age of 9. At the time, the approval was controversial, and the head of the FDA drug approval section, Dr. Alexander Fleming at the time, he was not happy with this approval. He described it as regrettable that the panel approved this Lupron for the use and treatment of precocious puberty. So he noticed that there were only 2 studies involved with it. One study followed only 22 children and only for 6 months. Not a very good study at all. And then there was another study which he just described as a free-for-all and fairly useless scientifically. So the story of Lupron did not stop there, of course. Now, much later in 2010, a doctor named Peter A. Lee made another study, this time studying a larger time span. However, the study was still limited, and this time only to 55 patients. A little better study. However, that study revealed that the drug was pretty dangerous. There were 9 patients who had severe side effects as a result of taking this, and 2 of them were left out of the study paper for no good reason. Now, AbbVie, the drug maker, just a few years later, paid Lee over $157, almost $160,000, to travel around the country and promote Lupron. So here, there's an obvious conflict of interest, and not good for the reputation of the drug at all. And the post-release data tracking the danger of Lupron continue to add up. Now, the most recent data I could find was for 2019, and as of that year, there were over 25,000 reports of serious or adverse events from people taking Lupron. Bone thinning and joint pain are the most common for young people taking Lupron before and throughout puberty. That's because testosterone and estrogen are instrumental in telling not just the sex organs to develop, but also the bones to build mass and density. And without those hormones present during the years where a person should be growing into an adult, they still have preteen bones on an adult, and so they're going to be very thin. They're going to have osteoporosis. This is a disease that is much more common in postmenopausal women. However, now it's becoming, because of the use of Lupron as a puberty blocker, common in young people. Now, also another common side effect is vision loss. Vision is so important. It's such a life enabler to be able to see well. There's also a drop in IQ, if you can believe it. See, the process of puberty is also in line with the process of brain development. And once again, the sex hormones are much more than just sex hormones. They're key ingredients in the development of so many parts of the human body during the period of puberty and the late stage of growth from a preteen to an adult. If that wasn't enough, and the people suffering from gender dysphoria have enough trouble as it is with depression and suicidality. But Lupron, even adjusting for that, for the tragic circumstances to begin with, makes people even more depressed and more suicidal. In addition to that, heart attack and stroke, bloody urine, having seizures, and the list goes on and on. I can't list them all here, but here in the slide here, you can see the link to see more if you're interested. Let's talk about some myths, common myths about puberty blockers. So one of the first and most common myths, and even doctors still say this to this day, they still claim this, that puberty blockers are reversible. This is untrue. Even now, Britain's National Health Service, not long ago, they were full in on the use of puberty blockers for preteens. Now they're having to reverse their position, acknowledge reality, and say, it's also not known whether hormone blockers affect the development of the teenage brain. Well, Scientists know that estrogen and testosterone are involved in the development of the human brain, and so what do you expect when they're cut off? And the side effects also include hot flashes, fatigue, and mood alterations. Well, there's an understatement for you. How about severe depression? There's a mood alteration for you. And another source in studies found that 62.5% of patients treated with Lupron for endometriosis had not regained their estrogen levels, their former estrogen levels, even a whole year after stopping Lupron. So no, they're not reversible. Another myth is that they're safe and effective. Well, let's ask the United States' largest insurer here, United Healthcare. Do they think it's safe? Well, they refer to Hayes Medical Technology Directory. In that directory, Lupron is rated D2, the lowest possible rating of any drug, because it appears to be all downside and no upside, no positive effects, and actually quite dangerous to take. Many side effects, and a lot of them severe. Another myth, gender-affirming care saves lives. I know this isn't directly about Lupron or puberty blockers, but this is the first step in this so-called gender-affirming care. And as you'll see later, taking puberty blockers inevitably leads to taking cross-sex hormones, and very often then doing surgical reassignment. And then 10 to 15 years later, after surgical reassignment, and some studies show more 7 to 10 years, the suicide rate explodes. This is very dangerous path that so many people are going on, and so many people are just not being told all the facts about this. But thankfully, there is a safer alternative. Before all the approval of Lupron and others for so-called gender-affirming care, and technically they haven't even been approved for that, using puberty blockers for gender-affirming care, using Lupron as puberty blocker at all is an off-label use, not technically approved exactly for this use, but they use them anyway. Before this came into popularity, into being, the traditional approach was watchful waiting, support from the family, perhaps support from a psychotherapist, talk therapy, and that has worked very successfully. 80 to 95% of people naturally grow out of their gender dysphoria. Puberty blockers just aren't needed. Not only are they dangerous, not only do they lead down a dangerous path, but they're just not needed. And and those small percentage where they don't outgrow those gender dysphoria, well, then you can go on this trans path as an adult and as a consenting adult. That's because, and as I mentioned earlier, a major study following dysphoric children who were administered these puberty blockers, 100% go on and continue on this path of cross-sex hormones and later surgical reassignment. So that hints at also kind of a psychological component of Lupron itself. So, there's been a classical definition of gender dysphoria, and someone who becomes extremely uncomfortable with their birth sex, and almost always this, up until recently, this has started pre-puberty. Prepubescent children become very strongly in favor and disfavor the toys and the clothes of their birth sex. So boys, they just have, and it's not just a phase. They just always want to wear the dresses and always have preferences for girls' toys and vice versa. Now, recently, there's been just this explosion of cases of gender dysphoria with people not showing these classical symptoms and classical traits pre-puberty. And so that's come to be called rapid onset gender dysphoria. And it turns out that there is a lot of social media, social pressure correlation that has changed recently. Humans themselves, their genetics haven't changed much, but social pressures sure have changed a lot recently. So that's where we really have to look for this explosion in this rapid onset gender dysphoria. And sure enough, the sufferers of ROGD have a marked increase in social media consumption prior to ROGD. They have a sudden and strong resentment of cisgendered people. And ironically, that even includes the gays and lesbians. The resentment is towards them. Anybody not trans is denigrated in their mind, thought of as evil. Another very common thing is someone in their social peer group has come out as trans. So they're all the markers of social contagion in this new development, this new evolution of gender dysphoria. So that leads to my general advice. I can't give any specific advice, but I think I can give you some good general advice. Starting with, accept who you are. Boys who have a feminine temperament and girls who have a masculine temperament are perfectly normal. That's been happening since the beginning of time. And there's nothing wrong with it, and it can be just accepted. Just celebrate your differences and celebrate who you are. Accept who you are and love who you are. You don't have to fit into any particular mold. You're just you, and you're beautiful, and you're wonderful the way you were born. Now, I want to also advise you to detox from social media, and so you can understand, why, especially with this rapid onset gender dysphoria, why it's important. Get it all off and uninstall it from your phone. Close your browser tabs and detox yourself. Social media is a huge source of anxiety and pressure, and it just might be killing you. And your reaction might be something like, "Oh yeah, not likely." Could you imagine your life without social media? It might be hard, but give it a try. It can't hurt. Nothing like the potential hurt of taking these dangerous drugs and leading down the path of surgeries with so many side effects and infections and difficulties and quite frankly, painful surgery along the way. So, and I think you might thank yourself for getting rid of it at some time. It might feel like you've just lifted a burden off of yourself. If you absolutely must watch some videos on the internet sometimes, well, that's okay. You can watch the Uncle Garrett channel. There's just good stuff here. So the other thing is, turn off your TV and stop watching movies. TV and movies are just another form of social media, another source of pressure and anxiety. The filmmakers and TV producers, they have an agenda. And often it does not align with your agenda. And so if you feel like I'm just piling crazy on top of crazy, am I insane are you kidding me? No social media and no TV. What's there left to do? Sit and stare at the wall? No. There's so much life out there. Go and grab it. Life watching TV is boring. Find something to do. The purpose of life is to improve yourself and improve the world. Find something hard to do. Find something you might even think is a little bit impossible, and tackle it to the best of your ability, making it as meaningful as you can. And in between, go to a skate park, go to a gym, find a beautiful hiking trail, learn to paint, knit a sweater. It doesn't matter. Creating things is so much fun. And last but not least, discover your true self. Whenever you have the urge to go on social sites or to flip on the TV, how about talking to yourself instead? And that can come in the form of writing a journal. Go out and get a notebook and a pen and write down your thoughts. If you prefer, type it out on the computer. It doesn't matter. What really matters is to be totally honest and open with yourself, with no judgments. Just pour out your thoughts. Write about your past traumas. So many of you, everybody has suffered traumas in their life, and some of you a lot worse than others. And I totally sympathize with you. And, life is hard, and it's so unfair sometimes. And you deserve so much better. But even though you didn't deserve it, well, it happened. So you need to process those traumas. I encourage you to take those traumas and paste them in your journal like bugs in a collection. Fully analyzed and processed and understood. And most of all, understood that you didn't deserve that. You deserve much better. Now, you might want to involve a professional therapist. That's okay. That's your choice. That may or may not help. Keep in mind, though, that in many countries now, if you go into a therapist and tell them you're confused about your gender, they are required by law to do nothing but say, okay, you're the other gender. I'm going to ignore everything else, all the other issues. The therapists are legally required to at least say, yes, you were born in the wrong body. Yes, you are another gender other than your sex at birth. And even in more free countries where that's not required, doctors are still human, and they still go with the flow. They still go with what's popular, and they're still most likely just wanting to push you along into this gender transition path. And that's why I kind of encourage journaling. It's something you can do for yourself. Um, and I'm not trying to discourage you from finding a therapist. If you can find a good one that will help you with all your issues, all your past traumas, that's great. I don't want to discourage you from that. Um, and and especially if you find a good one, it's a great thing. But journaling is something you can do for yourself, and it's free or practically free, just the cost of a notebook and a pen. And it has a long history. If you go to a professional therapist, they will likely advise you to do something very similar. And I'll talk more about that in a future episode. So in summary, beware of Lupron. It has a long and dangerous history. It has a history of really ruining the lives of people, with side effects of, osteoporosis and joint pain so bad that people can't even walk. And it's a very dangerous path to start on because statistically it's not reversible. Not by stopping the drug and not by, and the drug itself appears to even just continue psychologically to lead you down the path of more and more extreme transition steps. So I hope you found this helpful. I hope you can pass this along to someone in your life who is having trouble and might be confused. Maybe this will help them. I sure hope so. I want you all to live a happy and fulfilled life, and I want you to go down a path that is free of pain. and so thanks for listening. Please like this video, help it in the algorithms, help more people to find this. I'd really appreciate it. And other people who find it might appreciate you for hitting that like button and subscribing to this channel, making it visible to them also. So thank you, and until next time, this is Uncle Garrett. Goodbye.